In the name of Allah, who is most merciful and most beneficent. I'm Dr. Ambreen and I'm the course instructor of the course Pharmacology and Therapeutics 2. And today in this lecture, we are going to continue with our next topic of chemotherapy or antibiotics, that is aminoglycoside antibiotics. Previously, we have already gone through a topic of antibiotics, that was cephalosporins. So moving towards today's lecture, let me tell you the learning objective of today's lecture. Initially, we will start from the last lecture, that what we have studied, then we will move towards the today's part of the lecture, that is aminoglycosides. And I hope at the end of this lecture you would have a better understanding that what are aminoglycoside antibiotics, what is their mechanism of action, what are their uses, and what are the possible adverse effects that we may encounter when we are going to use aminoglycosides. So let's revise the last lecture. We have studied in the last lecture about cephalosporins. They are also antibiotics. Basically, they are beta-lactam antibiotics, so they do work exactly like penicillins. And we know how the penicillins are going to work. They are going to inhibit the cell wall synthesis. Similarly, cephalosporins are also going to inhibit the cell wall synthesis. So I said cephalosporins and penicillins are beta-lactam antibiotics. But we have different generations of cephalosporins, like first generation, second generation, third generation, fourth generation, and recently fifth generation also been introduced in the class of the cephalosporins. And all these generations actually vary in their antibacterial spectrum. As we have studied, that the first generation is good enough for the gram-positive bacteria like staphylococci and staphylococcus. And the second generation is good for gram-negative bacteria, while the third generation is good for gram-positive as well as gram-negative bacteria. Similarly, the fourth generation is also good enough like third generation for gram-positive and gram-negative bacteria, along with those bacteria who are going to show resistance to penicillins. So this was all about the cephalosporins, and we have studied also the details of the uses, that in which type of infections we may use, and which drugs are able to cross the cerebrospinal fluid, and which drugs can be used in case of meningitis. Like we said, first and second generation can't cross the meninges, so we can't use for meningitis. Even when the meninges are inflamed, they are not able to cross, except cefuroxime. Similarly, we said all the drugs can cross the kidney. They can pass out of the body through kidney, except two drugs of the third generation that are going to excrete out by the route of bile. Fine. So moving towards today's lecture, in which we are going to start from the aminoglycosides. Aminoglycosides, they are considered the mainstays for the treatment of serious infections, like they are considered good for aerobic gram-negative bacilli. They have been replaced to some extent by safer antibiotics such as the third and fourth generation cephalosporins. They are going to replace in certain conditions to fluoroquinolones to carbivinols. So they are good enough, so we are going to replace the third and fourth generation cephalosporins over aminoglycosides. What are aminoglycosides? They are actually, as the name is indicating, aminoglycosides. Two amino sugars are joined by the glycoside linkage to a central hexose nucleus. So two aminoglycosides are linked with a glycoside linkage, and we are going to call it aminoglycoside. So let me tell you about the name of aminoglycosides: gentamicin, amikacin, tobramycin, kanamycin, streptomycin, neomycin, and naltimycin. All the mycins are aminoglycosides: genta, amica, tobra, kana, strepto, neo, and naltimycin. All the mycins are aminoglycosides. So moving towards the mechanism of action of the aminoglycosides, it's very important. So let me tell you about something about that they are going to be good enough for only gram-negative bacteria. Why they are good for gram-negative bacteria and not for gram-positive bacteria? Because the gram-negative organisms have an oxygen-dependent system that transports the drug across the cytoplasmic membrane. There are two types of bacteria, gram-positive and gram-negative. Aminoglycosides are good for gram-negative because gram-negative cell wall has an oxygen-dependent transport system in their cell wall, cell membrane. And this cell membrane, this system, oxygen-dependent transport system, is going to help the drug to cross through the cell membrane and then make it able to get into the bacteria. While the gram-positive organism does not have oxygen-dependent system, due to which the transport of the drug into the bacteria is difficult. Fine. Aminoglycosides are susceptible only towards gram negative organisms. They allow the aminoglycosides to diffuse in their outer membranes through Podine channels. While the gram-negative organisms, we said, have an oxygen-dependent transfer system, and this oxygen-dependent transfer system allows these drugs to cross through the membrane, and then this drug is going to go inside the bacteria. Fine. I'm again and again saying aminoglycosides are effective only against gram-negative aerobic organisms because strictly anaerobes lack the oxygen-dependent system, so they are not going to work against them. Moving towards the further details of the mechanism of action, we have said there are different types of the bacteria. Few bacteria are going to inhibit the cell wall synthesis, few bacteria are able to inhibit the folic acid synthesis, and there are certain bacteria that affect the DNA. Similarly, the aminoglycosides are those bacteria that are going to inhibit the bacterial protein synthesis. The point is how they are going to inhibit the bacterial protein synthesis. They are going to inhibit the bacterial protein synthesis by binding with a 30S ribosomal unit. And by binding 30S ribosomal unit, they are going to misread the genetic code. And when they are going to misread the genetic code, they are not able to produce proteins for the bacteria. What is the mechanism of action? After crossing the cell membrane, they are going to bind to the 30S ribosomal unit. And after binding to 30S ribosomal unit, it is going to misread the genetic code. And when it is going to misread the genetic code, it is going to inhibit the bacterial protein synthesis. So in short, the mechanism of action of aminoglycoside is to inhibit the bacterial protein synthesis by inhibiting or by binding with the 30S ribosomal unit. There are two units of ribosome, 30S and 50S in the bacteria. And it is going to bind to the 30S. While the next topic we are going to study is macrolides, and they are the bacteria that are going to inhibit the bind with the 50S ribosomal unit. And this one, aminoglycoside, is going to bind with 30S ribosomal unit. So in this way, it inhibits the bacterial protein synthesis. So now moving towards the antibacterial spectrum. Aminoglycosides are effective in the combination for the empirical treatment of different infections like aerobic gram-negative bacilli that include Pseudomonas aeruginosa. Aminoglycosides are basically considered very good for Pseudomonas aeruginosa. And when we say what is the mode of killing the bacteria, it has a bactericidal mode of activity. We said there are two modes of drugs. Like few drugs are bactericidal in nature and few drugs are bacteriostatic in nature. And aminoglycosides are bactericidal in nature. Fine. And the last time we studied about cephalosporins, they were also bactericidal in nature. We have studied about penicillin, they were also bactericidal in nature. Additional one thing I need to tell you is, generally all those drugs that inhibit the bacterial protein synthesis are by nature bacteriostatic. जितनी भी ड्रग्स हैं जो बैक्टीरिया की प्रोटीन सिंथेसिस को इफेक्ट करती हैं वो बाय नेचर बैक्टीरियोस्टैटिक होती हैं, except aminoglycosides. There is an unknown cause that why they are going to act as bactericidal. Even all those antibiotics that just affect the protein synthesis acts as bacteriostatic, except this aminoglycoside that affects the protein synthesis, and still it is a bactericidal in nature. Is this point clear to everyone? I said all the antibiotics that inhibit the bacterial protein synthesis are by nature bacteriostatic, except aminoglycoside that also inhibits the bacterial protein synthesis, and even inhibiting the bacterial synthesis, it acts as a bactericidal in nature. And why it is so lethal that it acts as bactericidal even though it's just inhibiting the protein synthesis? All the other drugs that inhibit the protein synthesis though act as a bacteriostatic. Is this point clear to all of you? Hello?
Yes, ma'am.
Simply I'm saying
Yes,
जितनी
ma'am.
भी ड्रग्स जो प्रोटीन सिंथेसिस को इनहिबिट करती हैं, जितनी भी एंटीबायोटिक्स हैं, वो सारी, जैसे कि हम नेक्स्ट पढ़ने वाले मैक्रोलाइड्स, वो बैक्टीरियोस्टैटिक है नेचर में, एक्सेप्ट अमाइनोग्लाइकोसाइड। ये भी प्रोटीन सिंथेसिस को इनहिबिट करती है, लेकिन ऐसी स्पेसिफिक हमें कॉज नहीं नोन कि क्यों ये जैसे बाकी सारी कर रही हैं तो ये उससे डिफरेंट क्यों है, ये भी तो वैसे ही कर रही है, या बाकी सारी इससे डिफरेंट क्यों है। ठीक है?
Okay, ma'am.
The next is resistance. What is resistance? This is the resistance and tolerance that is showed by the bacteria. We said there are certain types of the strains of the bacteria that show resistance. Like these bacteria are going to show resistance by showing low affinity to ribosome. मीन कुछ बैक्टीरियाज ऐसे हैं, क्या करते हैं कि हमने भी कहा कि राइबोसोम ने ड्रग के साथ बाइंड करना है, वो क्या करते हैं, राइबोसोम इनके साथ अफिनिटी शो होने पे चांदना भी भूल जाती है, लाइक इट फील्स दैट आई डोंट नो यू, तो उसके साथ इतनी अफिनिटी शो ही नहीं करती कि हम दोनों ने बाइंड करना है, एक्चुअली आप ये ड्रग आई ही मेरे लिए थी और मुझे ही बाइंड करनी आई थी, ये राइबोसोम ही अपने आप को प्रिटेंड ऐसा करता है कि शो कराता है दैट I don't know how it is going to act. The next is aminoglycoside inactivating enzyme. Similarly, these drugs are also going to, these bacteria also release some enzyme that inactivates the aminoglycoside. जैसे हम पेंसिलिन पढ़ते थे, पेंसिलिन कुछ एंजाइम्स रिलीज करती थी कि वो पेंसिलिनेज जो एंजाइम्स थे वो बीटा लैक्टम रिंग को ओपन कर देते थे. सिमिलरली ये क्या करती हैं, अमाइनोग्लाइकोसाइड्स भी ऐसे एंजाइम, अमाइनोग्लाइकोसाइड्स के अगेंस्ट ऐसे एंजाइम्स बैक्टीरिया रिलीज करते हैं कि वो अमाइनोग्लाइकोसाइड्स को इनएक्टिवेट कर देते हैं. The third is some bacteria show decreased permeability of antibiotics. Antibiotics को permeability less show करते हैं. ठीक हो गया? So in this way, they are going to show resistance towards the bacteria or drug. So now moving towards the pharmacokinetic profile. What is pharmacokinetics? It is a study how the body is going to treat with the drug, that after administration, what is going to happen, how it is going to be absorbed, how it is going to be distributed, how it is going to be metabolized, how it is going to like excrete out of the body. So how it is going to happen is, when starting from the administration, as it is a highly polar polycationic structure of the aminoglycoside, it prevents adequate absorption after oral administration. When we take it orally, it's highly difficult for the drug to absorb because it has a high polar polycationic structure, due to which its absorption is going to be get reduced. So how we can manage this issue? We can manage this issue by giving these drugs parenterally. I mean, we may use intravenous or intramuscular injections in order to administer this drug instead of giving it orally. The bactericidal effect of aminoglycoside is the concentration and time dependent. I mean, how much effect they are going to produce, how much bactericidal they may be, it depends upon the concentration of the drug, how much you're going to give it, and the time dependent for how long it is going to stay, depending upon its plasma half-life. And that is, the greater the concentration of the drug, greater would be the rate of the organism that it is going to kill. The next is this is another additional point, that is a post-antibiotic effect. Post-antibiotic mean after its half-life has been completed, it leaves an impact that after its excretion, it still have an impact that it has worked very efficiently, that there are no bacteria that remains after it. Because of these properties, once daily dosing with aminoglycosides can be employed. The post antibiotic effect mean एक ड्रग अपने ही जाने के बाद भी वहां पे अपना इफेक्ट छोड़ जाए, that is post antibiotic effect. And due to this, once daily dosing, it has less toxicity, it's less expensive to administer. You have to take one dose per day, so it's relatively less expensive. You are going to take only one dose for one day, so it's affordable actually. Then is distribution. All the aminoglycoside have a similar pharmacokinetic properties. Concentration in the cerebrospinal fluid are inadequate even when the meninges are inflamed. So high concentration accumulate in the renal cortex, in the endolymph, perilymph, in the inner ear, which may account for their nephrotoxic and ototoxic. aminoglycosides के बारे में एक बहुत important बात मैंने लूप डाययूरेटिक्स भी पढ़ा रही थी, बताई थी कि aminoglycosides are going to cause ototoxicity. If anybody किसी को याद हो, मैंने last time कहा था furosemide and aminoglycoside, they should not be given together. Why they should not be given together? Because they both are going to cause ototoxicity. So you will never use any two drugs that are going to give you same potential adverse effects. As these aminoglycosides, they are metabolites and they are going to accumulate in the renal cortex, यानी हमारी किडनी में, और in the endolymph and perilymph of the inner ear, हमारे inner ears में, हमारी किडनी में, they are going to get accumulated. Due to it, it is going to cause nephrotoxicity ये हमारी नेफ्रोटॉक्सिसिटी कॉज करती हैं, नोटोटॉक्सिसिटी कॉज करती हैं. एंड दीज टू आर द major adverse effect of using aminoglycosides, that they are nephrotoxic and they are ototoxicity. So when we are going to study the adverse effect, number one is the nephrotoxicity, and even before that is ototoxicity. So whenever the name of aminoglycosides comes, the other adverse effect is that comes in our mind is ototoxicity. Let me revise the name of the drugs that are going to affect are gentamicin, amikacin,
kanamycin, and tobramycin and cobramycin. So they are all the drugs that are going to act as aminoglycoside. Is my voice clear to everyone?
Yes, ma'am.
Okay. So I am again going to revise all the drugs that are going to be used as aminoglycosides. They are going to give you two potential adverse effects. Number one is nephrotoxicity, the other one is ototoxicity, because they are going to get accumulated in the inner ear and also in the renal cortex. So all the aminoglycosides also cross the placental barrier. ये placental barrier को cross कर सकते हैं, may accumulate in the fetus and amniotic fluid, so we should try to avoid it to give it to the pregnant women. The next is about excretion or metabolism, that what is going to happen after it is going to absorb and after it is going to cause its effect. Then it comes the step of metabolism. So metabolism of aminoglycosides does not occur in the host. ये as such ये metabolize नहीं होते. All are excreted in the urine. वैसे के वैसे सारे urine में excrete हो जाते हैं, and predominantly by the glomerulus filtration. Accumulation occurs in the patient, और इनका ये अपना आते हैं, गुजरते गुजरते अपना काम करते जाते हैं, बॉडी से बाहर चले जाते हैं. एंड स्पेशली जिन पेशेंट्स की किडनी और लिवर फेलियर है, उनके अंदर फिर ये जा नहीं पाएंगे. सो उनके अंदर हमें डोज एडजस्टमेंट करके देनी पड़ेगी कि क्योंकि उनको रिनल फेलियर है. सो यू नीड टू गिव इट अ स्लाइट डोज दैट एक्चुअली इट इज नॉट गोइंग टू एक्सक्रीट वेल आउट ऑफ द बॉडी ड्यूरिंग द टाइम स्पैन ऑफ अ डे. Next are the adverse effects. So before adverse effect, do you have any question related to this? Anybody has any question related to the mechanism of action, related to their pharmacokinetic profile? Hello.
No, ma'am.
So Samya, would you like to tell me any name of any two glycosides? Shabash. Aminoglycosides, any two.
Gentamicin, amikamycin, cobramycin.
Sorry, I can't hear you properly.
Gentamicin, amikamycin,
Gentamicin,
cobramycin.
kanamycin, tobramycin, amikacin. All the mycins are aminoglycosides. Kindly keep a register or pencil with you. जो भी आपको important points लग रहे हैं, आप साथ में note करते जाया करें, ठीक है? And Muzna, will you like to tell me what is the mechanism of action of aminoglycosides? Muzna, can you hear me? जी, Samara, are you with us? Can you tell me the Hello.
जी मैम. जी मैम.
Muzna, what is the mechanism of action of aminoglycosides?
मैम aminoglycosides combine irreversibly to the smaller subunits of ribosomes of the bacteria, and that's how they inhibit the protein synthesis in bacteria.
So that's how they inhibit the protein synthesis in the bacteria.
Yes,
जी,
ma'am.
next is Samara. Samara, kindly unmute your mic.
मैम आई गेस समरा इज नॉट अवेलेबल. उसकी लाइट नहीं आ रही सुबह से, दैट्स व्हाई.
Okay, Gania. Is Gania with us?
Yes, ma'am.
Gania, would you like to tell me either they are bactericidal or bacteriostatic? These aminoglycosides. Very good. Bactericidal. So how would you define the term bactericidal? What do you mean by the term bactericidal? You know, Gania, what is bactericidal?
Hello. जी मैम.
So let me tell what is the term bactericidal. Is Ghazia with us? Ghazia, unmute your mic. Hello. This is not good
Ma'am,
anyway.
Ghazia nahi.
Okay. So moving towards the adverse effect, I'll again ask the questions at the end of the session. Please kindly focus on the lecture, what I'm going to tell you. Moving towards the adverse effects. As the picture is displayed on the screen, there are four major adverse effects. Number one is ototoxicity, that we are familiar with this. Number second is nephrotoxicity. And the third one is it is going to affect the neuromuscular junctions. And number fourth is it is going to cause hypersensitivity skin rashes. So let's describe or discuss all these in one by one. Number one is ototoxicity. We said aminoglycoside has well documented side effects, that is ototoxicity. What it is and how it is going to happen. Actually, the antibiotics is going to accumulate in the endolymph and perilymph of our inner ear, and the toxicity relates with the number of the destroyed hair follicles in the organ of cotton. What is going to affect is ये एंटीबायोटिक जो हमारे एंडोलिम्फ और पेरिलिम्फ में accumulate हो जाती है एंड वहां जाके ये हमारे हेयर सेल्स हैं उनको डिस्ट्रॉय कर रही है. एज अ रिजल्ट इट causes deafness. Ototoxicity is said to be the deafness. और ये क्यों हो रही है? Because our antibiotic is going to accumulate in the endolymph and perilymph of the inner ear, and this is going to cause the destruction of the RA cells in the organ of Corti. That is going to cause deafness. But the good thing is, sorry, this is not good. The bad thing is this deafness is irreversible, that it can't be like come back again, because our hair cells are going to destroy it, and they are going to destroy it completely. So even after leaving the medicine or after stopping the use of the medicine, the effect of the ototoxicity remains. So we'll try to avoid it, to use it a minimal possible dose, so that we may prevent this effect of ototoxicity. Let's revise that this antibiotic is going to accumulate in the endolymph and perilymph of the inner ear, and it is going to destroy the hair cells in the hair follicle, and that is going to cause deafness. And this deafness may be irreversible. If it's irreversible, you can't hear it again. So it has been known to be affect fetus in the uterus. So even if the pregnant woman is going to take Visal, it may cross a placental barrier. So even it may accumulate in the inner ear of the fetus. So patients who are simultaneously receiving another ototoxic drug like cisplatin and loop diuretics like furosemide, bumetanide, ethacranic acid, they are particularly at a high risk to develop ototoxicity. Patient who are taking simultaneously, like if I'm taking diuretics or cisplatin, that is an antibiotics, and meanwhile I do also taking gentamicin, then my furosemide and gentamicin both are going to give me a more higher risk to develop ototoxicity. Next we have is more about ototoxicity. What are the signs and symptoms the patient is going to experience along with ototoxicity that is going to affect the sound or hearing ability? Vertigo and loss of balance may occur. It may be sometimes that you just have a vertigo and a loss of balance, especially in the patient who are receiving streptomycin. इतनी सारी जो हमारी aminoglycosides थी, gentamicin, उसमें से एक streptomycin थी, and especially about streptomycin that it gives you loss of balance and somehow dizzy feeling. And the patient usually experience nausea, vomiting, dizziness, headache, nystagmus, and ataxia. The next second adverse effect of aminoglycosides is they attain higher concentration in the kidney that may cause damage to the tubules, and this effect may be reversible. While our first effect was almost irreversible, but this nephrotoxicity is reversible. So what happens is कि ये जो drug है ये हमारी kidneys के cells में जाके accumulate होना शुरू हो जाती है, हमारे tubules को damage कर रही होती है, और this damage is like represented as nephrotoxicity. The third one is neuromuscular paralysis. And we have studied about this in detail, that what is neuromuscular paralysis mean, neuromuscular muscle relaxation. And we have studied in the chapter of skeletal muscle relaxants that what is going to happen, that why this muscle relaxation is going to occur. We have studied about Curera, like here it is written that aminoglycosides have effect like Curera, and what is the Curera effect they are going to cause, ये क्या थी, this is a poison जो हमारी, और इस तरह की हमने बहुत सारी drugs बनाई जो muscle relaxation cause कराती थी, and how they are going to cause muscle relaxation, ये हमारे जो neuromuscular junction थे और उनके फॉर एग्जाम्पल इफ आई से कि ये हमारा नर्व टर्मिनल है और ये हमारी प्री सिनेप्टिक मेम्ब्रेन है, ये उसके अंदर वेसिकल्स हैं और उसके अंदर एसिटाइलिन एक्यूमुलेटेड है, और ये हमारी साइनेप्टिक लेफ्ट है और ये हमारी पोस्ट सिनेप्टिक मेम्ब्रेन है, इसके ऊपर रिसेप्टर्स है। रिसेप्टर्स दो तरह के होते हैं, मस्क्रेनिक या निकोटिनिक। निकोटिनिक हमारे स्केलेटल मसल्स के ऊपर होते हैं, तो here we are discussing in the sense of nicotinic. So एसिटाइलिन यहाँ से आती है और निकोटिनिक रिसेप्टर्स पे लगती है और कंट्रैक्शन कॉज कराती है। लेकिन हमारी जितनी भी ड्रग्स जो स्केलेटल मसल रिलैक्सेंट के तौर पे एक्ट करती हैं, सिमिलरली aminoglycoside वो इसके एंटेगनिस्ट के तौर पे एक्ट करती हैं और आती हैं और इस रिसेप्टर को ब्लॉक कर देती हैं। जब इस रिसेप्टर्स को ब्लॉक कर देती हैं, it doesn't allow the acetylcholine to attach to here. When the acetylcholine is not able to attach to this receptor, so it would not be able to produce the next contraction, and this way it is going to cause the relaxation of the muscle, and if this relaxation continues, we are going to call it paralysis of the neuromuscular junction. So patient with the myasthenia gravis are particularly at higher risk. उनके अंदर तो पहले ही रिसेप्टर्स बहुत कम होते हैं और उस पे एसिटाइलिन बहुत लेस वर्किंग कर रही होती है, और अगर एक myasthenia gravis का पेशेंट एक इसको भी यूज कर रहा होगा तो उसको क्या होगा, एसिटाइलिन की वर्किंग पुअर हो जाएगी और वो नहीं काम करेगा। They are going to get more adverse effect of the myasthenia gravis. Prompt administration, how we are going to manage it. Prompt immediate application or administration of calcium gluconate or neostigmine. Neostigmine कौन है? It's anti-cholinesterase drug. Anti-cholinesterase mean cholinesterase को enzyme को inhibit करने वाली drug. Cholinesterase enzyme कौन था? Cholinesterase एक ऐसा enzyme था जो एसिटाइलिन को सिनेप्टिक लेफ्ट में डिग्रेड करता था, और माइस्थीनिया ग्रेविस के पेशेंट में जिसने aminoglycosides खा ली जो कि एंटागनिस्ट के तौर पे एक्ट कर रहा है एसिटाइलिन के, और उसने साइट्स को कवर किया हुआ है, हम चाहते हैं कि ये साइट से डिस्प्लेस हो जाए, तो हम क्या करेंगे, ऊपर एसिटाइलिन की कंसंट्रेशन हाई कर देंगे। एसिटाइलिन की कंसंट्रेशन कैसे हाई कर देंगे, जो उसको किल करने वाला एंजाइम है उसको वहां से इनहिबिट कर देंगे। जब वो नहीं होगा तो एसिटाइलिन होगी, एसिटाइलिन होगी तो वो उसको डिस्प्लेस कर देगी। ठीक हो गया? In this way, we can prevent the neuromuscular paralysis. The fourth effect is allergic or hypersensitivity reaction. Contact dermatitis is a common reaction to topically applied neomycin. So this is seen with certain aminoglycosides. Moving towards precautions after studying the adverse effects. Precautions are the things that you need to take care of when you are going to use aminoglycoside. So before seeing this slide, we know 2 or 3 things that we already said, that we are not going to use aminoglycosides with loop diuretics or cisplatin. Why we are not going to use aminoglycoside with the loop diuretics? Because they are both autotoxic. So we don't want to get this autotoxicity. Fine. The next is avoid simultaneous use of nephrotoxic drugs like amphotericin and cephalothine and cisplatin. और दूसरी ड्रग्स जो कि नेफ्रोटॉक्सिसिटी जो किडनी को इफेक्ट करती हैं वो हम नहीं यूज करेंगे, क्योंकि उनके यूज करने से किडनी और ये सब मिलके ज्यादा नेफ्रोटॉक्सिसिटी कॉज करेंगे। Number 3rd thing is avoid consciously in elderly patient जिनको renal dysfunction है, उनके अंदर skeletal मतलब जो skeletal muscle relaxants यूज कर रहे हैं और जो aminoglycosides यूज कर रहे हैं, दोनों को इकट्ठे नहीं करना चाहिए, क्योंकि ये भी muscle relaxation करा रहे हैं, ये भी muscle relaxation करा रहे हैं, so both are going to cause like more relaxation. Number 4 is it is contraindicated in pregnancy, because we said this drug has a capability to cross the blood-brain barrier, so we are going to avoid to use it in pregnancy. Another very important thing about aminoglycosides is we will not use it in the same syringe. We will not mix 2 aminoglycosides in the same syringe because they do cause chemical interaction. So we will not use aminoglycoside with other aminoglycosides or any other drug. हमको कभी भी होता है कि एक syringe हम 2 इंजेक्शन यूज कर लेते हैं कभी कभी इकट्ठे, लेकिन aminoglycoside के किसी के साथ नहीं करेंगे क्योंकि ये एक दूसरे के साथ chemical reactions करते हैं. Fine. So let's take a break. Let's revise the previous thing. What we have studied, we have enlisted the names of the drugs that are aminoglycosides. Number one is gentamicin. Number two is streptomycin. Number three is amikacin, tobracin, kanamycin, streptozin. So they are all aminoglycosides. The second important thing about that was that it is going to act as bactericidal. Bactericidal drugs are those drugs that kills the bacteria. And how do it kill the bacteria? Then there comes a mechanism of action that it kills the bacteria by binding to the 30S ribosomal unit, and after binding to 30S ribosomal unit, it inhibits the bacterial coding and inhibits the bacterial protein synthesis. Another important thing is it can cross only gram-negative aerobic bacteria because they do have an oxygen transport system in the cell membrane that allows this bacteria to cross the membrane and come in the bacteria. But still there are certain bacteria that show the resistance. How they show the resistance? Few bacteria does not allow it to come inside. Few bacteria that does not, their ribosome does not like show affinity to the drug, and few bacteria the least aminoglycoside inactivating enzyme. Then we have studied about the pharmacokinetic profile. Then we have studied about their adverse effects, that they are ototoxic, they are nephrotoxic, they cause skeletal muscle paralysis, they are going to give you hypersensitivity reaction. Fine. And also we have studied that they causes ototoxicity that is irreversible. They even causes nephrotoxicity that is reversible. Now moving towards the uses of aminoglycosides. There are a long list of uses that is enlisted here in a few coming slides, that these aminoglycosides are preferably being used in these conditions. In infections due to enterococci. Enterococci are generally resistant to many antibiotic classes and may require two synergistic antibiotics for the elective therapy. They are actually two like active type of bacteria. They are resistant type of the strains that do show a resistance to almost number of the drugs, and due to which we need to give a combination of two drugs that are going to control it. Like we're going to use gentamicin or streptomycin in this class with vancomycin or beta lactam antibiotics like penicillin. तो हम दो से almost दो drugs use करते हैं in order to cover the effect of these enterococci इनको kill करने के. Like recommendedly इस class में gentamicin या streptomycin, और यहाँ इसके अलावा आप vancomycin या beta lactam like ampicillin. Beta lactam means penicillins. The next is infection due to Pseudomonas aeruginosa. Pseudomonas aeruginosa rarely attacks healthy individuals, but it do attack those individuals that have less immunity, like immunocompromised persons or inborn victims that have a weak immunity. It do affect those individuals. And treatment includes tobramycin. This is one of the member of these aminoglycosides in combination with anti-pseudomonal penicillin like piperacillin or ticarcillin. We have studied this piperacillin and ticarcillin in penicillins. उसमें हमने पढ़ा था. Next is toledemia. It's acquired disease during the rabbit hunting season by the hunters killing infected animals. Pneumonitic toledemia results from the infection by the respiratory route. Gentamicin is elective, or it's like very good or drug of choice in treating the different lymphoid I mean हमारे जो lymph nodes हैं उनकी disease को treat करने के लिए भी use करते हैं. And this is all about aminoglycosides. If you have any questions related to this, let me ask. But I have questions that I will ask. G, do you have any questions you want to ask? Dear respected class, are you with me?
Yes, ma'am.
So do you have any questions related to this?
No, ma'am.
No questions. Okay, Ji. First starting from Namra. Hello,
Yes,
Namra.
yes, ma'am.
Namra, can you enlist any names of the drugs of aminoglycosides?
Ma'am, aminoglycosides are all the mycin: streptomycin, gentamicin, kanamycin, tobramycin, amikacin, neomycin, and natilmycin.
Good. So next is Nushaba. Nushaba, kindly unmute your mic. Nushaba. Ji Humaira, kindly unmute your mic.
Yes,
Humaira.
ma'am.
Humaira, what is the mechanism of action of
Yes,
aminoglycosides?
ma'am.
What is the mechanism of action of aminoglycosides? Shabash. Very good. आपको आता है
Ma'am,
mechanism of action?
ma'am, aminoglycosides are effectively against aerobic organisms
Very
because
good.
the lack of oxygen requiring drugs transport.
Okay. So who will tell me that next is Asha Najib? Asha
Hmm.
Najib. Asha, what is the relationship of protein synthesis with these bacteria? How this drug is going to affect the protein synthesis?
बिकॉज किस तरह
Shabash.
मैम सेल मेम्ब्रेन को क्रॉस 30s राइबोसोम्स के साथ बाइंड करके
शाबाश, इनको
इनहिबिट।
बाइंड करती है और मिस रीड करती है जेनेटिक कोड्स को। इस तरह ये बैक्टीरिया प्रोटीन सिंथेसिस को इनहिबिट करती है। ठीक हो गया जी। मरियम तारिक।
Yes, ma'am.
Mariam, would you like to tell any two adverse effects of aminoglycosides?
ये ऑटोटॉक्सिसिटी करता है और उसके बाद हमारी नेफ्रोटॉक्सिसिटी करता है। नेफ्रोटॉक्सिसिटी है जो वो रिवर्सिबल है, क्योंकि वो रिवर्सिबल नहीं है क्योंकि वो हमारे ट्यूब्स में जाता है और उसको डिस्ट्रॉय कर देता है। ऑटोटॉक्सिसिटी रिवर्सिबल है
ठीक हो
सम
गया
केस।
जी। The next is Ghazia. Ghazia, unmute your mic. शाबाश। अच्छा, what is this autotoxicity? How would you explain this autotoxicity? क्या होती है ये?
मैम बेसिकली ये aminoglycosides जो होती हैं वो इनर ईयर के अंदर जाकर इरिवर्सिबल डैमेज करती हैं, जिसकी वजह से परमानेंट डेफनेस होती है। और इनको हमें जो डायूरेटिक्स हैं लाइक फ्रूसिमाइड वगैरह उनके साथ इसको कंबाइन करके नहीं देना चाहिए, प्रिस्क्राइब नहीं करना चाहिए। और जो एल्डरली
Very good.
इंडिविजुअल उनके अंदर
Thank
फिर
you. Thank you,
एक्स्ट्रा
जी Ghazia. Thank you, जी। With this, I'm going to end up today's session, and the next lecture who will be able to continue the macrolides. Initially, you will revise this lecture and then move towards the macrolides. Thank you. I'm going to close the today's session. Allah Hafiz.